It's Ken Connors filling in for AC 7:10 on this Tuesday morning. It's the time of year, of course, as we approach the new year. That week between Christmas and New Year's, maybe a lot of people make some charitable donations, different organizations, worthwhile organizations, before the year is out. And just how far do your donations and your dollars go when you donate to one of these charities or organizations? So, one of the reasons why I invited Julie Quenneville, who is the president and CEO of the MUHC, on the phone, MUHC Foundation. She's on the line with me this morning. Julie, hi, how are you?
Good morning. Thanks for the invitation.
Oh, how was Christmas?
Well, it was extremely quiet.
Yeah.
Not the way it used to be.
Yeah.
That's for sure.
Julie, last year at this time, we had a similar conversation, and COVID, of course, threw a wrench in everyone's plans and altered everyone's work life in one form or another, and it did the same to you last year. How was this year in terms of, the emergence of the variant? What number did that play on you and your work?
Yeah, we had not made a full return to the office like most businesses. We were monitoring the situation and waiting for the government to update the policies and recommendations. I think the difference this year, Ken, is people's hope. This latest wave made people a little less hopeful for the future. I am extremely optimistic. I speak to the MUHC experts on a daily basis. And this is a much less severe variant, and we are quite hopeful that this wave is coming to an end very soon, and we will be able to, with, of course, our third doses, be able to reopen and get back to our new norm.
Yeah, that seems to be the what we're learning about it slowly, day by day, is that it's maybe the symptoms and its impact not as severe. It's just highly contagious. I mean, everyone knows someone who has it.
I think almost everyone I know is in isolation right now.
Yeah.
We are lucky and unlucky in my household. The kids and I had COVID back in March of this year, and I have to admit that I was sick for about 3 months, and much happy to see that this variant is causing 2 to 3 days of flu for the large majority of people. So let's work together and try to help each other through this difficult time.
All right, let's get to these charitable donations that a lot of people make for tax purposes, of course. Not only it's the goodness of their heart, but also for tax reasons at this time of year, to get one in before the end of the year. When you make a donation to the MUHC Foundation, can you tell us where the money goes and how much impact it has?
Absolutely, and that's an important question. I think that when you are looking at the charity of choice and deciding where you're going to invest your hard-earned dollars, those are the questions you should be asking yourself: is where am I going to have impact? And I hope that people are investing where they are most passionate, because it should be a wonderful experience as a family to decide what impact we want to have on the community that we live in. Now, at the MUHC Foundation, the cost ratio is something that we take very seriously, and we work very hard with our board of directors and our team to make sure it is that as much as possible is actually going back to the hospital. So our cost ratio has always been between 18 to 19%, which is extremely good. You should be looking at least a maximum of 25% in terms of cost ratio. That means that 75% of funds raised actually go to the cause at hand, and they have an impact on those institutions. And for us, it's also important to have, even on our website, easy to read, showing the impact. You should always know as a donor exactly how the organization is going to use the funds that you are donating.
Julie, are there, we're with Julie Quenneville from the MUHC Foundation. Julie, are there internal discussions or debates as to where the priorities should be and what the priorities are for the money?
On a daily basis. And that discussion happens with the MUHC leadership, and it happens with the Research Institute leadership on a number of levels. First of all, we are absolutely not there to replace government. Government has its responsibility. It is responsible for providing quality care across the province. Now, philanthropy has the responsibility to provide the difference between quality and excellence. And so those are the conversations that we have. Is what is going to make that big difference. And we also want to look at those priorities that are going to allow us to leverage philanthropy. What do I mean by that, Ken? Is every dollar that we invest from the community should allow the institution to secure up to $4 in various different government grants. So research is extremely easy in that way. We pay for the proof of concept when it comes to a research project, and then they can secure a research grant from a number of different organizations, including government, to be able to actually scale up the project. And we saw wonderful examples of this during the pandemic where, for example, we opened in March of 2020 the first lab in Quebec where we could manipulate COVID-19. It takes an ultra-specialized laboratory to do that. And, in September of 2020, the federal government came in, our $150,000 opened it up, and $2.1 million came from the federal government. So that was a wonderful leverage to our investment.
With Julie Quenneville from the MUHC Foundation, they give us Health Matters every Sunday at noon here on CJAD 800. Julie, I have about a minute and a half, but can you just briefly remind us and tell us about the progress of the Dovey clinical trial?
The Dovey project, Ken, is just about the most important thing that we will have done in Quebec. Ovarian and uterine cancer is still one of the greatest killers of women because we can only detect it when it is in stage 3 or 4. And by then, it is extremely difficult to cure. And Dr. Lucy Gilbert and her team over the years have developed what is now the only diagnostic test that can actually detect ovarian cancer in stage 1 and 2. And this is super important because if we can diagnose it in stage 1 and 2, we can cure it. So we're not developing a new medication to cure cancer. If we can diagnose it in stage 1 and 2, and we saw this in breast cancer, that's how we got the survival rate to 90%, then we could cure it. And this project is now in stage, in the stage 3, in a phase 3 clinical trial. So we have to see 3,000 women here in Montreal. We have seen more than 500 already. And once we've completed this, we can take this diagnostic test and we can make sure that in every doctor's office in the world that it is available for women. And this will be like the Pap test did for women already. It'll save millions of lives around the world. So we're extremely excited about this.
Julie, my wife Lorena, signed up. She got her appointment and she came home and she could not have raved more about how well organized and how compassionate and how thorough everyone was along the process for her appointment. Well,
this is another example, Ken, of philanthropy at its best. We put in $2 million. Genome Canada put in $2 million. Genome Quebec did as well. And then we will bring this diagnostic test to the world. So what a wonderful example.
Julie, always a pleasure having you on the show. Keep up the great work and all the best to you and your family and your team in 2022.
Thank you so much for the invitation.
Julie Quenneville from the MUHC Foundation brings us